It has been estimated that the use of contraception can prevent 12 million unwanted pregnancies every year. Hi everyone, in this video I will be discussing all there is to know about the combined pill, also known as the pill, as a contraceptive method. So stick around to find out about the benefits and the negative side effects that are associated with this contraceptive method. Hi, if you are new to my channel, my name is Tandy and I'm a medical scientist who makes the findings of medical research more accessible and more usable to you. In this video, we're going to be continuing our video series on the use of contraceptive methods. So first on our list, as mentioned earlier, it's the combined pill. So now what the combined pill is that it's one of the short-acting hormonal contraceptives that we discussed previously in this video. So if you haven't watched this video yet, please be sure to check it out so that you can have some sort of understanding of what it is that we're going to be discussing and all the other contraceptive methods that we are going to be discussing in this video series. The combined pill contains artificial hormones, progesterone and estrogen that are naturally produced in the ovaries. So how does the pill work? The pill works by one, it prevents ovulation, and secondly, it prevents the sperm from entering the uterus and fertilizing an egg. So now, one of the important questions that usually you want to know before you go on any contraceptive method is how effective it is. The combined pill is one of the most effective methods out there, in that if you are using it correctly, it is 98 to 99% effective in preventing pregnancy. Meaning that less than 1 out of 100 women will become pregnant in the first year of using this contraceptive method. So what you need to understand is that the effective rate is calculated based on using this contraceptive method perfectly. So what this means is you have to use it how it was intended to be used every single time that you do use it, right? So if you're not using it correctly, obviously the effectiveness goes down. And with typical use meaning that you are perhaps skipping days, you're not using it every single day, or maybe you're not taking it at the same time every day, then usually it becomes about 91% effective. So in this case, it means that around 9 out of 100 women who use this contraceptive method will fall pregnant in their first year of using it. So then the next important thing that you would want to know is, how do you take this pill or this contraceptive method? Because again, this will impact your lifestyle, right? The pill is one of those methods that before you commit to it, you really need to be ready to commit throughout. You need to be disciplined because you have to take it every day, and not only every day, you have to take it around the same time every single day, right? And because the pill, you take it orally, and sometimes you can take it without even having to use water. And yes, I'm speaking from experience. Because I'm a positive person and I like focusing on the positive things in life, I'm gonna first discuss positive side effects that are associated with using the combined pill. So, okay, one being that the combined pill, sometimes it's used to treat menstrual related disorders, right? So for instance, if you have a heavy flow and perhaps you get really painful periods, they can prescribe this combined pill to help you treat that. In other cases, this pill can be prescribed for people that experience endometrial related pain. It can be prescribed for migraines that you sometimes can get from your period. If you have irregular menstruation as well, so if your period are not consistent, then you find that sometimes you get them for 2 months, you don't get them. the combined pill can be effective in helping to treat that so that you get your periods regularly. Another instance is with fibroids, where this pill has also been shown to be beneficial in that regard. One particular positive side effect that I personally liked about using this contraceptive method is it's the fact that I had control over when I have my period, right? So especially, you know, when you are going away with your mens and you want to make sure that you have your period outside of that going away period so that you can do the nice things with your person. I really liked that about using the pill. So that was one positive experience for me with this particular contraceptive method. Another positive side effect is that in average risk women, they have found that it can reduce your risk of getting endometrial cancer and ovarian cancer. So that's nice. You know, cancer is not nice to have, so it's nice that maybe something like this could help reduce your risk in having such horrible diseases. Another case where it's very beneficial to take this contraceptive method, or this contraceptive method has actually shown to benefit people, is in treating mild acne. So I think the common brands that are used to treat mild acne includes Yasmin, Marvello, I think, Diane, Jeanette, for example, but there are very few or limited combined contraceptive methods that have been approved in helping to treat mild acne. So yeah, those are the brands that typically I think you will get prescribed if you are someone who struggles with acne. So now we are gonna look into the darker side of things, right? So now we're gonna look at the negative side effects that are associated with using the combined pill. So I'd like to reiterate that contraceptives affect us differently, and as a result, the severity of these side effects may differ, or even sometimes you might experience a side effect that's no one else in your circles has experienced, right? So that might just be a rare side effect. It does not negate it as a side effect because other people aren't experiencing it. So in this case, I'm just going to discuss the common negative side effects that are associated with the combined pill, not all of them, as I believe that some of them aren't yet even documented, you know, but it doesn't negate their existence. So the first one, and a very obvious one, is costs. I mean, we know that if you're not on medical aid, for instance, and you can't maybe go to a government clinic, you don't have the time, right? You don't have the time to go to a government clinic because we all know that the lines tend to be very long there and the poor medical professionals are understaffed. So in that instance, you'll have to cough up money to go see a GP, right? So you have to pay for consultation, and then afterwards you have to go get the medication from a pharmacy and have to pay for that too. So that can be something that causes a lot of people to not want to use this contraceptive method, and that is a very valid concern. Another one is breakthrough bleeding. So with breakthrough bleeding, essentially it's when you are spotting, particularly when you are spotting, like you have blood spots outside of your period. So that is another common side effect that's been seen a lot with the combined pill. Another one is a very low sexual drive. So, you know, for some people they say they even get a little bit drier down there, so it can make sex also a bit more painful, and you just don't feel like having sex as much anymore because, you know, just the drive is not there anymore. Your libido is down, it's downhill. Another one is nausea. So with nausea, apparently they say that the way that you can deal with this is by taking the pill at night, for instance. Apparently that helps to ease the nausea. Another one is headaches. Some people experience headaches when they're on the pill, and that is not pleasant. And then for those that use the pill and like you smoke at the same time, one of the yeah, one of the side effects, but this is a rare side effect, is that you can actually get blood clots, particularly in your large veins. I think this condition is known as deep vein thrombosis. Deep vein thrombosis, DVT. But as mentioned, this is a rare side effect. So I know with me, when I started taking the pill, I was told by my doctor, she asked me if I smoke, and yeah, that's because it can lead to blood clots, which can lead to a lot of complications for you. And we're very young for that. We're too young for that, right? We're here for a good time. So yes, another one is, but this is not highly documented or even that well researched yet, but there has been some reports that show that some people that are on the pill tend to develop yeast infections, right? There tends to be a correlation between being on the pill and getting yeast infections. So this is because it's believed that the use of hormonal contraceptives that have estrogen in them may be linked with yeast infections, because what happens is that these hormones can disrupt the body's natural hormonal balance, and it can help the yeast to grow. So what you need to know is that your vagina already has yeast in it, right? Your vagina is its own environment with its own organisms in there. It has yeast in it, it has bacteria in it. So what happens is that the estrogen in birth control pills, it can cause the bacteria in the vagina to produce more sugars, right? As a result, these sugars then will feed the yeast that's already living in the vagina, causing it to overgrow, which then causes a yeast infection. So as I mentioned, this is not very well researched. So far there has been a correlation, but as we know, correlation does not mean causation, but also it tends to indicate something that needs to be studied a bit further down there. So I do think that there needs to be more studies that actually investigate this, because yeah, I do think that there might be something there that needs to be looked at. So another one is, there seems to also be a growing concern that hormonal contraceptives may have psychological effects. So similar to the correlation between the pill and yeast infections, this is also not a very well researched area where they've actually showing, there isn't a lot of research that is showing how hormonal contraceptives could have psychological side effects. But there is a study, it was a cross-sectional study, that showed that 61.2% of participants with a history of psychiatric illness were significantly more likely to report mood changes as a side effect of using hormonal contraceptives, compared to 29.5% of participants with no history of psychiatric illness, right? So I personally also know of a few of my friends who have kind of experienced something similar, that when they are on the combined pill, they find that, yeah, especially around that time of the month, sometimes leading to your period, you may feel some type of way. I know some people feel really sad. It's like everything that you're feeling becomes overly exaggerated, like a few days leading to your period. And I find that when I was on birth control, I also kind of experienced the same thing, where I was really, really low. Like the low was lower than any other low that I've ever experienced when I was on the pill. And when I compared it to when not being on the pill, I could see that I don't experience the same mood when I'm not on the pill. So yeah, although the research and the literature is limited in this area, I think there might be something that needs to be extensively investigated there, because it does seem that there is a bit of a connection between the two things. So who can use the pill? Because the pill has significant drug interactions, the patient's medical history should first be checked before you get on this contraceptive method. In some instances, the pill has been shown to interact with certain antibiotics. In other cases, it can interact with some epilepsy medication. So it's very important to disclose this to your healthcare professional, your medical doctor, your nurse, so that they know if you actually can be on the pill and it won't result in any issues. The thing with drug interactions between medications is that it it can make the one drug ineffective, right? Or it can make it lose its effectiveness. So you don't want to be on the pill only to find that you are 70%, you are protected 70% of the time and not 98% of the time or 99% of the time. So it's very, very important to disclose this before you, with your medical doctor or nurse, before you get on the pill. Another case in which people are usually advised not to use the pill, it's usually if you smoke, particularly if you smoke apparently about like more than 15 cigarettes per day and you're over the age of 35, you are usually advised not to be on the pill because this can result in increase your chances of getting blood clots. So yeah, we don't want that, right? We do not want that at all. If you have a pre-existing cardiovascular condition as well, if you have a history of stroke, if you have uncontrolled hypertension, it's usually not advised to be on the pill, but please make sure that you speak to your medical doctor about this, so that, because it's gonna differ, right? It's a case by case kind of thing, and it's gonna differ depending on your situation. So it's very, very important that you disclose all of this before you actually get on the pill, so that you know there aren't any dangers for you, there aren't any issues that will arise from you using this contraceptive method. Now, where can you find the pill? So in South Africa, you can find the pill from, you can get it from government clinics, and usually it's free. If you're on medical aid or you can afford to pay out of pocket, you can get a script from a GP or a gynecologist, and then you go get the pill from the pharmacy. Alternatively, you can go see a nurse inside some pharmacies, such as Discam and New Pharmacy. So they have nurses, or clinics. They have clinics inside of the pharmacy, so you can actually go see a nurse, and it's usually cheaper as well. I think last time I checked it was around 75 rands, so that's not bad, right? So you can go see a nurse from Discam or from New Pharmacy, and you're able to get the pill from there as well. So guys, if you know of any other places where you're able to get the pill, please share those places in the comments below, so that other people can also know about these places and can potentially use them as well and benefit from it. So now, protection against STIs. Does the pill protect you from STIs? No, it does not protect you from STIs. So it's very important that when you are on the pill, you use it in conjunction with a barrier method, such as a condom. In that way, you are protected from having diseases that you don't want to have. I don't think anyone wants to have them. So ensure that you are protected twice, always. Yeah, we're here to live a long and healthy life, right? So let's take care of ourselves. So in some cases, some people can't take estrogen. So in that case, that means that you can't take estrogen-based contraceptives, right? So there's an option for that. Like maybe you can't take estrogen-based contraceptives, but you still want to be able to take the pill because it's effective, and you feel like since you can take it, like you're disciplined enough to take it every day, it works best with your schedule and your lifetime. Then there's another method. So this is the progestin-only pill. The progestin-only pill does not have estrogen in it. So this also means that all the side effects that are associated with estrogen as a hormone, you're not going to be experiencing them with the progestin-only pill, right? So this is what we will be discussing in the next video. The progestin-only pill, the side effects of using this pill, where can you find it, how does it work, so on and so forth. So we'll watch it next on the video that I will be releasing very, very soon. So yeah, guys, thank you so much for getting to the end of my video. If you found it useful, please share it so that others can also benefit from it. If you have any other questions or comments about the combined pill, please share them in the comments below, and I will do my best to address them. So yeah, thank you so much for staying to the end of my video. I will see you in the next video where we are talking about the progestin-only pill. So thank you. Bye. Please note that all the information that will be provided on this channel is for educational purposes only and not intended to be a substitute for medical advice. So if you have any specific or general medical concerns, please make sure to consult with your medical doctor.